Thank you for inviting me to speak today. I've had the real privilege of working with Mask Together America, PanEnded, COVID Safe Maryland, the American Public Health Association, and a number of struggles over my lifetime. Their work with the most recent groups of disability activists has informed much of what I want to share today. Also, my years of activism have convinced me that we have to build a broad, multiracial, and militant movement that brings in all parts of the working class. Fighting for disability justice, just like fighting racism, benefits everyone. All people can contribute skills and experience to building a better society. So why does this not happen? It is impossible to discuss long COVID mitigation and treatment without understanding how capitalism views healthcare for the majority of the population. First of all, capitalism operates above all to generate profit for the ruling class of industrialists and financiers. To this end, it needs people to be just healthy enough to work for them and to fight their wars. Those who are most valuable to their system receive better health insurance and programs to keep them healthy. If it was up to the capitalists, there would be no need to take care of chronically ill people, people with disabilities, long COVID patients, and the elderly. But this default position of the ruling class has been challenged by mass movements against racism, war, and poverty. And so the capitalists have grudgingly provided some health care for various groups. The creation of Medicare and Medicaid emerged from the civil rights movement, for example, and included the anti-racist demand of integrating our hospitals. Today as well, anti-racist struggles can be merged with disability justice issues to strengthen our position. Some of us are looking at ways to look at the prison health system and long COVID as well. COVID-19 helped many people understand more about the system's values. Old people, Native Americans, and Black and brown essential workers in transit, education, and healthcare, and many others suffered and died disproportionately. Triage in the emergency room included value judgments about quality of life by doctors and nurses who never knew anything about the patient in front of them. Patients who were old or had disabilities were judged to not have a life worth saving, a statement that echoed the Nazi medicine of Hitler's Germany. I think it's interesting that some folks in the government seem to realize that these ethical questions are important. When Section 504 requested comment on the type of judgment and triage, there was quite a bit of response. However, the methods and accessibility of SSDI show that this is mostly a sham, as long COVID patients find support in this area to be very difficult and consider a myth. Limited accommodations in the universities and workplaces have become the norm. Tailoring medical practice to include safety measures for COVID and appreciation of the reality of long COVID are surprisingly difficult, as many here can attest. In addition to denying treatment to millions of workers in the United States, the capitalists distort research in the name of profit. The pharmaceutical industry has benefited from payouts and protection for vaccines and pills like Paxlovid. This industry is the most profitable in the United States. But, it's also quite expensive to the capitalists. So therefore, they don't really want to spend too much of that money on people with serious illnesses unless they are very valuable to their system. Research is tailored to creating treatments for diseases that affect large numbers of people that may have many things less severe than long COVID, but where there is profit to be made. Mitigating COVID risk for the population with improving ventilation in schools and offices is an expense not worth it to the capitalists because workers can be replaced. They also think there will be enough children to provide a new generation of workers and soldiers. Research funding and pharmaceutical solutions constitute another fight which many of us have been involved in. There is one more dimension to the struggles against capitalism. This is in the international arena where regular people all over the world are struggling against imperialism. While the ruling classes fight over oil and other resources, the working classes suffer. The genocide in Gaza is the most current example, and the disability from injury, malnutrition, and infectious disease, including COVID, are horrific. The profiteering seen in the COVID vaccine rollouts was most obvious in the fact that rich countries had it and others did not. Protests of the World Trade Organization went unheeded. Building international solidarity for health is a critical agenda point. So the fight for a world where resources are shared, all are valued, equity is the rule, and everyone has a chance to contribute is a huge task. Broadening the struggle to include disability justice, along with the fights against racism and sexism and ageism, are important to win reforms and ultimately revolutionary change. Today, this event is a move in the right direction. Thank you.